as well as to our ranking member. The chair noted that I served on the Budget Committee in the 112th Congress, but it appears that I have returned to the Alternate Facts Committee, because that's what we've been subjected to throughout this hearing. Madam Chair, I respectfully want to share with you, in case you aren't aware, that I know you referenced 28,000 people in Tennessee supposedly losing coverage from TennCare, which existed before the Affordable Care Act, but I wonder if it would surprise you to learn that 28% more Tennesseans gained coverage under the Affordable Care Act. That's 266,000 people in Tennessee who now have coverage, which is a far sight better than the 28,000 you referenced who supposedly lost it. I'm also confident if you checked, you would probably see that most of those 28,000, if not all of them, were able to gain more affordable coverage under the Affordable Care Act. In my state, 1.3 million Floridians gained coverage who didn't have it before, the most in the country. And I'll note something that we haven't really talked about here. Let's focus for a moment on the fact that people with employer-based insurance would be gravely harmed from the significant benefits that they gained under the Affordable Care Act. The return of annual and lifetime coverage gaps, coverage limits, preventative care without a copay or a deductible like mammograms, colonoscopies, well woman care, all of which made health care more affordable. By the way, the availability of birth control for free without a copay or a deductible has contributed to a precipitous drop in the unwanted pregnancy rate. So the majority of people who already had coverage before the Affordable Care Act will be significantly harmed by repeal. I want to note also that Dr. Book clearly referenced in one of his responses that he supports returning to health underwriting, which was extremely dangerous and harmful and expensive and contributed to death spirals when we had a purely private market-based system. Ms. Turner is clearly advocating returning to strict private market practices that were unaffordable and harmed millions of people. So let's be very clear here. There has not been a replacement plan proposed, and respectfully, my colleagues on the other side of the aisle had 7 years to do that and still have not done it. We have millions of people who gained access to health care that didn't have it before, millions of people who had health care coverage and got better coverage, millions of seniors who can have more affordable prescription drugs, and frankly, also have benefits like being able to go get a checkup every year without a copay or a deductible. Representing a state that has the largest percentage of seniors in the entire country, I can tell you that most of those folks were only able to go to the doctor when they were sick because they couldn't afford copays and deductibles on a well-care visit for them. So we're keeping them healthier as a result. In my last under 2 minutes, I want to ask Mr. Haselmeyer, do you believe that, and I would like, in the interest of time, just a yes or no answer, do you believe that all Americans should have access to quality, affordable health care? All? Yes or no? Given the time constraints, again, please answer with a yes or no, and can we agree that health care is a right and not a privilege?
That's the wrong question.
Yes or no? No, you don't get
no,
to,
no,
you
no,
don't get to dictate
no,
the
I'm
question,
not going to
sir.
answer
yes
or no on that because
clearly because you probably don't think it is.
Because
and
all
before the
healthcare
ACA, if you won't answer my question,
facelifts aren't right.
I get to add, my name's on the door, so I get to ask the questions and decide which ones are right.
Okay, but you
clearly don't believe that the health care is a right, not a privilege. None of the majority witnesses do. And before the ACA, there was no all-out ban prohibiting discrimination against individuals with pre-existing conditions until age 26, correct?
No, that's not true.
No, it is true. There's no question that an insurance company could drop people or deny them coverage.
No, that's not true. Congresswoman, if you actually read the 1996 HIPAA law, you would understand that that's not true.
That would be news to the thousands of people that I know in my district were dropped or denied coverage. As a breast cancer survivor, I can tell you that I have spoken with many of my sister survivors who were dropped in the middle of their treatment by their insurance company and had to choose.
And that was illegal and they had recourse.
No, it wasn't illegal. It happened.
It was.
Every day. And they had to choose between either the chemo or the radiation because they couldn't afford the copays or deductibles on both. That is the nightmare.
The ACA doesn't require coverage for either.
Excuse me, I haven't asked you a question, Dr. Book. Madam Chair, if you could return a few seconds of my time because I keep getting interrupted, I'd appreciate it. Thank you so much. At the end of the day, the majority is clearly proposing to repeal the Affordable Care Act without assuring us that we would have universal access to quality, affordable coverage. That is unconscionable, unacceptable, and we will not allow you to do it without a fight.
The lady's time has expired. I do want to recommend to my colleagues, they keep saying